Today's question is, what was your worst experience at a doctor's office?
I specialize in intellectual disability and mental health. Both are things that general doctors and nurses know little about. I'm also a psychologist. However, I work very closely with many of my clients as my company also provide general support services, and occasionally I will need to assist a client to attend a GP visit. When I do, 90% of the time they presume I am a lowly undereducated support worker. I have had a flying doctor in a rural/remote hospital tell me that because the patient who had just had a heart attack had no family and an obvious disability, once in the air they would just let him go. I've never had to suppress white-hot rage like that before, but I managed to deal with her respectfully and keep the patient alive. Took my sister, who has a severe intellectual disability, but does not present as disabled, to a GP, and the GP refused to allow me into the room with him. I tried to explain. Sister at the time was nearly nonverbal and didn't know what she was there for anyway, but he was condescending and dismissive, absolutely certain of himself, and that I was meddling. After quite firmly being shut down, I said okay then, and took a seat in the waiting room. About 2 minutes later, he popped his head out looking a little less certain of himself and asked if I wanted to come in. I replied that I was sure he had it well in hand. He'd be all right without me, no doubt. 5 minutes later, he popped back out and asked me to please come in. Complete attitude change. I went in, and my sister had taken everything off his desk and put it in her bag, and was happily dancing to herself and playing with his container of tongue depressors. He looked at me and almost apologetically said, "I think she may have a disability of some sort." I told him that was very astute of him, emptied my sister's bag of his desk things, grabbed my sister, and left to find another doctor. Had a GP, and then 2 different ER doctors tell me a client was fine, despite being yellow and constantly vomiting. I pulled Ryan's rule and forced them to test. Client had a ruptured gallbladder. Briefly had an Aboriginal client with mild mental health issues, nothing too serious. Stumble and collapse in the gutter. Doctors and nurses all said he was drunk. Patient was known to us to not be a drinker and sent him home. Dead of a brain aneurysm 45 minutes later, and autopsy revealed no drugs or alcohol for the record. Client, single dad to 4 kids, has severe abdominal pain and vomiting for 2 days, dehydrated and cannot walk. So sick he can't get out of bed. His kids actually walk to our office to get help, call an ambulance and get him to the hospital, where they turn him away for drug-seeking behavior and report him to Children's Services. Children's Services arrive a couple of hours later, enter the home where he has been returned, and yes, it was a mess. Dude wasn't doing any housekeeping due to being bedridden, and Children's Services took one look at him and went, "Oh, this dude is sick as hell," and called another ambulance. Children's Services put the kids with us while he was in hospital. He gets to hospital a second time, and they turn him away again for drug-seeking behavior. He is sent home. So I go pick him up, take him to the hospital a third time where they try to argue the problem is mental health. The symptoms are psychosomatic. I argue they're a hospital. Do their darn jobs. I kicked up enough of a stink that they finally scanned his abdomen and found some mesh from an old surgery had come loose and was fucking up his gut. Had several GPs tell schizophrenic patients they could safely stop taking their medication. Healthcare for people with intellectual disabilities and/or mental health issues really needs strong advocates because they are so often dismissed by regular medical personnel, especially if they have a dual diagnosis. Because all too often a GP will ignore a mental health problem in favor of the disability or vice versa. They don't need medication for this. They're just disabled or intellectual disability. No, this behavior is because they're obviously on drugs/have a mental illness. I have a condition called recurring corneal erosion. Basically, the surface of my cornea is weak, so my eyelids form a seal and can stick to my cornea and tear it if I'm not extremely careful with how I open my eyes each morning after sleep. Usually when it does tear, it's extremely painful for 12-ish hours, and that eye is very blurry for another 2 to 3 days before finally healing on its own. Every so often, though, there are small flaps of corneal tissue that are still attached that are extremely painful and actually gets worse over time. It hurts so bad that I can't even use my good eye. Since my bad eye will mimic the movements of my other and just cause more pain. So I'm essentially blind for days. I just flew to San Francisco for work and it happened while there. Started getting worse, so I knew I had some corneal flaps needing to be removed. Couldn't sleep, went to the ER at 6 a.m. I only had to wait for about 15 minutes before getting wheeled into a room. The ophthalmologist should be here in about 15 minutes, says the nurse. Can I get you anything? Water. This was the last time I saw the nurse. They just disappeared for the rest of the day. The ophthalmologist shows up 5 hours later, me not knowing what's going on, just sitting in my blinded pain. He checks me out for 15 minutes, confirms that there are indeed flaps of tissue, but doesn't want to cut them off. He wants to check the rest of my eyes out and needs to dilate them. So he adds the drops in and says he'll be back in 15 minutes. 3 hours later he returns and is shocked that my eyes aren't dilated, because he was gone for so long that they had time to return to normal. He puts more drops in, says he'll be back in 15 minutes. 3 more hours pass. Nobody knows where anyone else is. My nurse has vanished. My doctor vanished. I start trying to flag down other people's nurses to get more info, but nobody knows anything. Eventually, about 3 hours after my last interaction with him, the doctor returns with the head of ophthalmology to examine me. She says pretty much the exact same thing as the first one. Not gonna cut the flaps off or give me a protective lens. These help so much. Because they don't want it to cause an eye infection, and that essentially I should just schedule an appointment with someone back in my home state. They said they're going to go ahead and prescribe me some antibiotics, but then literally just walk away nearly mid-sentence. They had their backpacks on. They left for the day. I wait another 2 hours for someone to maybe give me the paperwork, prescription, anything really. I'm blind, so I don't know what the fuck is going on. I don't know what to do, so I just start yelling for someone to please help me figure out what to do. Other nurses come to my aid and start trying to help. The head of the ER finally comes to see me about an hour later, apologizing profusely that this happened to me, that multiple doctors and nurses just forgot I existed. He handed me the paperwork for the prescriptions, but I asked if he could prescribe something for the pain as well, since it's an 11-10 on the pain scale. He says he'll need to reprint it with the new prescription and he'll be right back. Then he fucking leaves too. 2 hours later, I still have no idea what's going on or where he went. It's now 8 p.m. I've been in the hospital for 14 plus hours for something that should have been 30 minutes, and they've essentially done nothing for me. Eventually, some other nurse that had helped me earlier helps me complete the process and get me my paperwork. I am writing this with a still half-functioning eyeball. TLDR. Multiple doctors and nurses forgot I existed, so I spent 14 plus hours in extreme pain and blind for them to do essentially nothing for me. The worst I've had was at a psychiatrist's office. This is clearly not on the level of some posts here with life or death issues, but it still boils my blood to remember it. February 2020, a month before the world shut down. The doctor was pretty old, probably mid-70s, had a plaque on the wall for 40 years of practice. My daughter had been diagnosed with ASD, autism spectrum disorder, about a year earlier, and we had asked for a referral to a psychiatrist to explore medication options for ADHD-type symptoms. We had some issues prior to the appointment where her diagnosis assessment when his office called to demand we fax the assessment papers over to his office by the end of the day 2 weeks prior to the appointment, or lose that date. The psychiatrist made us leave the room while he interviewed her, which bothered me because I had weird vibe already but thought okay, that's he needs to see here without us influencing her behavior. Half an hour later he calls us back and asks why we think she has autism. I told him she scored very low for social cues, distractibility, task completion, and understimulation. If these are not the actual categories for ASD, I'm not remembering it all exactly, but that does describe her. At the time, I practically quoted the DSM-5. He told me she doesn't have autism, she makes eye contact. I told her that yes, we've spent a year teaching her to do so. He told me that she laughed and played with him and clearly didn't have autism. I told him that she was diagnosed with autism spectrum disorder. It's a spectrum, not a is or isn't type of thing. He again asked me, quite sternly, to justify why I thought she was autistic. I told him I'm not the doctor. I didn't diagnose her. He has the notes in the full assessment. Why doesn't he tell me? Then told me he didn't have time to read it. His office made us run around town getting paper copies to fax in 2019 because email was not secure enough, or they would cancel only to be told he couldn't be bothered to read it. I was getting really upset, and my wife was practically crying at this point. I told the doctor this was unfair of him, that he was demanding we defend something a diagnostic psychologist had written, and that there must be a breakdown in our communication here because I was feeling a little attacked by this. He shrugged and told me the communication problem is on your end. I'm not treating you unfairly, and I resent you trying to pin this on me. I'm still upset at that smug old asshole. It's like he had no idea what ASD even is and was using a 1970s definition of autism. He's a child specialist, for fuck's sake. How many other families got this kind of bullshit care? What kind of a shithead does read a diagnosis after threatening to cancel an appointment because they didn't want an emailed copy but a faxed copy, and then demands the parents to explain it and defend it? We did make a complaint to College of Physicians. No idea what become of it though. But fuck that guy. My daughter is now thriving with the help of Concerta. She's gone from requiring a full-time education assistant just so that she can function in school to having no assistance and keeping up decent grades. And this is the end of today's video. I hope you liked it, and don't forget to comment an anecdote or experience similar to the topic of the video. Leave your like, share if you liked the video, and lastly, don't forget to activate the little bell so you don't miss any of our daily videos. Bye-bye.